Nigeria's family planning funding has seen consistent cuts since 2019, affecting access to essential services and contraceptives. This alarming trend has been detrimental to the health of the country's population. This has resulted in challenges related to population growth, demographics, and national development. Habeebat Ajayi reports.
The cuts to funding of the health sector did not start this year. In 2022, there was no budget line for family planning, and while there was an improvement in 2024, the 2 billion naira budgeted for family planning commodities fell short of what was needed to meet targets. However, the sad situation has been exacerbated by the suspension of global funding, notably from the US government. The Development Research and Project Center DPRC says collective efforts are urgently needed to address the funding gaps. Taking it further, civil society organizations CSOs insist that this is a call to action to the federal government and other actors to explore alternative funding solutions.
Any money that government agrees to do in terms of counterpart support, if it is not in the budget, it will be living in the sector-wide votes. It all means that the minister has to ask for that money. So we're now going to make sure that we also ask for that money. Finally, it is also important that they told us that one of the DLIs in the swamp is linked to family planning. So in other words, we are going to see how they are going to put money for family planning.
With that, 3 billion out of that can provide free health insurance for 200 million Nigerians this year. And you would have still had 4 remaining for other work you want to do. So we should return to a field where, one, this country can afford, believe you me, to provide free health insurance for 200 million Nigerians. It will just amount at 15,000 per annum. It will be 3 trillion.
To address the funding crisis, experts have urged government to increase domestic resources mobilization while leveraging existing strategies.
As Nigerians lean towards the public and towards the private sector, there's going to be a lot of pressure there. Pressure in the sense the client, there's going to be higher or heavier out-of-pocket expenditure. And then do we have enough commodities within the private sector to be able to cater for the fallout? And these are the things that would make us begin to think outside the box as advocates. There was something Dr. Ejike said, and I had put that down, that our advocacy messaging has to change.
So we're calling on civil society organizations, not just the Population Association of Nigeria, but you all have to lend a voice. We all have to speak together with one voice. Advocate that a lot more must come to family planning, health services, and health in general before the budget is passed.
Civil society organization has been urged to seek funding from diverse sources beyond the government in order to bridge the gap in health financing across the nation.
For CSOs, yes, our job is to support government in areas where we think that they are lacking, using funding from other sources. However, now that the funding has now closed up, and we're not so sure it would return, let's be quite honest with ourselves. This is a Republican government that is not so keen on reproductive health.
In related news, the chairman of the Nigerian Population Census has announced that the upcoming national census will be digitalized, promising more accurate and reliable data for future planning. Habeebat Ajayi, Trust TV News, Abuja.